So, welcome to all of you doctors and welcome to our new joiners as well. I hope my platform will be an important platform in your journey. For the new joiners, I am Dr. Sahar Ali, the founder of PLAB 2 Warriors groups. I have Telegram group, Facebook group. We have also Discord server as well. I am an NHS doctor working in acute medicine unit. I do provide private mocks with detailed verbal and written feedback. I do provide full course with mind maps and simulated scenarios by me. I do the role play of the doctor. I do provide also the practical course as well. This practical course contains simulated scenarios on a simman, a real simman. I'll talk about this at the end of the session. If anyone interested, please stay till the end. Let's begin our new plan together. Let me tell you first our plan for the session today, just to be aware what we are going to do. Please, doctors, always give a plan. Making a plan or a framework to your audience is always important, and this makes them comfortable and ready to hear. My advice to you, when you talk to your patient, please give a plan first, especially when you give the management, to make them comfortable and ready to hear you. Our plan for today is to take the first station with one of the doctors, and I will give the comment on the performance. Then we will study together the first mind map from my course. Then we will take the second station in a simulated scenario with other doctor, and we will do the same as we did in the first station. Questions at the end, please. I'll try to answer all of your questions as long as I know the answer. Inshallah, I know most of the answers, inshallah. Let's get started. Okay. So today we are going to take two stations in history-based approach. We are going to take two stations in the hospital setting. So the two stations are in the hospital, you are in the A and E. So let's get started. You will have the first station, Dr. Anju.
Yes.
Just let me set the timer. You will
Yeah.
have 1.5 minutes to
Mm-hmm.
read your question, and
Yeah.
then you are going to start. So start, doctor, to read your question, please.
Yeah.
Start, please.
Hello, I'm Dr. Anju. I'm one of the doctors here in A&E. Can I confirm your name and age, please?
Yes, doctor, I am James Cullen, and I'm 40 years old.
Okay. Nice to meet you, James. So how can I help you today?
Thank you, doctor. I have back pain, doctor.
Oh, you seems very painful, right? So
Yeah.
can you tell me more about that?
Uh, Doctor, I have this pain here in my lower back, in the lower part, in my
Mm-hmm.
back here.
Mm-hmm.
It started uh, since yesterday.
Okay. So what were you doing exactly when the pain started?
Oh, I was playing squash, and it started after finishing it, to be honest.
Okay, so your pain is only at the lower back. Is it going anywhere?
No, it doesn't go anywhere.
Okay. So anything that makes your pain worse?
Um, Nothing, doctor. Just, when I move myself,
Mm-hmm.
it is getting worse.
Okay. So anything that makes your pain better?
No.
Okay. Have you tried anything to relieve your pain, like any medications, anything?
The nurse gave me diclofenac, and it's getting better now.
Okay. So are you better now and comfortable to talk now?
Yeah, a little bit, yes, doctor.
Oh, thank you for that, James. And James, do you have any other symptoms or any problems?
Nothing to be honest. No, just the back pain.
Okay. So do you have any weakness or any numbness in your legs or foot?
No,
Okay. Do you have any kind of tummy pain?
no.
Okay. Any urinary problems?
No.
Okay. So James, do you have any kind of any throbbing sensation or something like that in your tummy?
No.
Okay. And by the way, what kind of pain it is?
It is dull aching, doctor.
It is, sorry?
Dull aching. It's dull aching.
Oh, okay, okay, okay. And James, do you have this pain for the first time or did you had it earlier?
No, this is the first time for me, doctor, to have this pain.
Oh, okay, okay. So do you have any other diseases that you have been diagnosed of?
No.
Okay. Are you taking any medications?
No.
Okay. Do you have any allergies?
No.
Okay. Do you have anyone in your family has any kind of diseases?
No, doctor, not that I'm aware of.
Okay, James, thank you for that. And James, I would like to ask some more questions about your lifestyle. It may sound silly to you, but it may help me to know you better. Okay.
Okay.
Okay. Do you smoke, James?
No, doctor.
Okay. Do you drink alcohol?
No.
Okay. So, James, what is your job?
I'm a banker.
Okay. So how's your physical activity like?
It's fine, doctor. It's fine. I try to walk every day, and I
Mhm.
like squash. So yeah, I consider myself healthy. Yes, doctor.
Uh-huh, okay. So after you had this pain, are you able to walk properly and to do your daily activities?
No, to be honest, no.
Okay. Do you live alone or with your family?
I live with my wife.
Okay. So you have support from your wife?
Yes, 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 doctor.
Okay, that's great.
Mm.
So James, now I would like to check your vitals.
Okay,
And I'll also check your head to toe examination. And I'd also like to examine your back, especially your lower back area for any tenderness.
okay,
And I'll also look at the nervous system examination of your both of your legs.
okay.
Is that okay for you?
Yes, doctor.
Okay, and I'll also send some initial investigations, like some routine blood test, and all. Okay,
Yes, doctor. The examination is in front of you now, doctor.
sorry.
The examination is on the screen.
Okay. Okay. So James, do you have any idea what is going on with you right now?
No, doctor. To be honest, no.
Okay. So sorry, James, do you have any expectations in particular about with this consultation?
If just to give me anything for this pain, it will be helpful, doctor.
Oh, sure, I'll give you painkillers, no problem. I'll be very quick to give you the medicines, okay?
Okay.
Yeah, and so you have told me about your condition, and I have also have the examination results with me now, and from my assessment about all these, I think what you have is a back sprain. That means when you told me you were playing squash yesterday, so it might be some kind of straining for your muscles.
Hmm.
Are you with me, James?
Yes, doctor, I am with you. So can I play squash again?
James, there's no problem for playing the squash again. You can, but the thing is that you had a sprain yesterday, so you have to rest for a while. Then
Hmm.
after that, you can play squash again. But be more careful, like when you suddenly, turn into your side and all. Please be careful for a bit. That's all.
Okay, okay, doctor.
Are you with me? Are you with me, James?
Yes, doctor, I am with you.
Okay. So James, now what I'm going to do for you is, first of all, I'll give you some painkillers that might help you with your pain. And you were taking diclofenac, right,
Yes, doctor.
James?
Yes.
Okay. So I can give you some ibuprofen or paracetamol, and you can take that.
Okay.
And um, also I'll have some kind of further investigations if it helps in ruling out certain things.
Okay.
Okay,
Yes.
I'll also discuss it with my senior so
Time is
that
done.
he can. Okay,
Okay.
thank
Good,
you.
good. Thank you, Dr. Andrew. Thank you so much.
Thank you,
You did
doctor.
it. You did it well. You did it well. Thank you so much. Just give
Thank
me a
you.
second.
Thank you, doctor. I was so tense.
How
My
do you
hands
feel?
are
Yeah.
like very cold now.
No worries. So, how do you feel about your performance before I give you the marks?
Actually, I think the initial part was okay, and but when I reached the last management part, my I was kind of heart beating and all. So,
Yeah. Okay. No
so
worries.
I was a bit anxious for the last things, and I
Yeah.
yeah, I don't know.
Okay, but you did it well. You did it well. You missed a few things in the management part, and this is
Yeah.
the common thing between doctors. It's a common thing. Don't worry about this.
Mm,
But we need
yeah.
to work on the management a little bit. You still have time
Mm-hmm.
till your exam, so
Mm-hmm.
just some modifications and you will be fine. But your
Mm-hmm.
interpersonal skills, um, your way in talking with the patient is fine. Nothing to worry about your way. We just need to
Mm-hmm.
work on the management. Let me give you the marks. Okay. In data gathering, I would give you 3 in data gathering. Okay. In
Okay.
management skills, I would give you 2 in management
Mm-hmm.
skills. You give me the diagnosis in a very simple way. You
Mm-hmm.
you were interactive. You addressed my concern. So yeah. In
Mm-hmm.
interpersonal skills, I would give you also. I would give you 3. Okay.
Mm-hmm. Mm-hmm.
So you have a take in the management part.
Yes.
Okay. So yeah,
Yes.
and time management as well.
Mm-hmm.
The
Mm-hmm.
time management is not for because you didn't manage to finish in time. No,
Mm-hmm.
the
Mm-hmm.
time management is about consuming the time in the most important things in the station. It doesn't mean at all that if you have a tick in time, it doesn't mean at
Mm-hmm.
all that you didn't finish the station within 8 minutes. Um, Lots of doctors didn't finish within 8 minutes, but they still got 12. Okay.
Mm-hmm.
So it's
Okay.
about consuming the time on the most important points in the station. So yeah,
Okay.
well done.
Mhm.
So you need to work on the management, and we are going to talk about this. Don't worry.
Doctor, one doubt. So, about consuming time in the most important part. So here I have to spend more time in management.
Okay, so you need to start your management at least or maximum at after 4 minutes. Okay,
Okay.
so
Okay.
divide the station in two halves, half for your
Okay.
data gathering, half for your
Mm-hmm.
management, because you will show the examiner your interpersonal skills in your management. You're not going to show the examiner your interpersonal skills or how to deal with the patient or how to be patient centered in your data gathering, because in the first part you just ask you the questions. Okay,
Okay.
so the important thing is your management. If you think about history taking, it's just
Mm-hmm.
only 2 points from 12 points in your station. Okay, so because
Okay.
data gathering is not only history
Um,
taking, it's history taking,
uh,
examination, and investigation, and this is as
okay.
per
Okay.
GMC. Let's talk about the station. Okay,
Mm-hmm. Thank you, doctor.
thank
Because I was thinking, actually the reciprocal. Because I always practice like the 6 minutes for data gathering, examination, and all, and 2 minutes for management. That was my mistake.
yes,
So
I
you
highly
was like
advise
very
you,
open.
yeah, I highly advise you
Yeah,
to take
yes,
your
I will.
history
Yeah,
quickly and then start your management as early as you can, just to
yeah.
show your interpersonal skills and your way in talking with the patient.
Okay. Thank
Okay,
you so much, doctor. Thank you.
thank you. So let's get started. Let's take
Mhm.
the mind. We have our lovely map here. The first map is saying hello for you. So let's talk about the mind map. So as you can see here, I have divided my mind maps into halves. The first half for data gathering, the second half is for the management. As the exam, exactly. I hope that we all know that the data gathering is history taking, examination, and investigations. It's not only history taking. This is as per the GMC. Okay? In your history, you need to grade the patient, you need to take your present history, past history, personal history, 4Ps, psychosocial, and ICE, please, ICE. As you can see in the present history, which is the most important point in your history taking, is exploration of the presenting complaint and asking about anything else. I have written the exploration of the complaints in details in my mind maps. In each station, you will find if the patient is presenting with, let's say, anything apart from other than pain, like, let's say, burning while passing urine, anything. I have written the exploration in details in each map, and in anything else, I have written the most important thing that you need to ask about, especially the red flags. Then your past history. Did that happen before? Any medical conditions? And MAFT. MAFT is for medical condition, medications, allergies, family history, and travel. Then your personal history, diet, exercise, smoking, and alcohol. 4Ps if the patient is female, and psychosocial part is really, really important when you think that this problem can affect the patient life, job, or mood. Then ICE, you need to ask the patient ideas, concerns, and expectations. This is how to see or how to find out what is in the patient's mind. Explore the patient's mind, please, doctors. really, really important to know what is his concern. Maybe he has read something in untrusted site over the on the net, and he asking for advice. So you need to correct this kind of information. So please try to find out what is in the patient's mind to address this the first thing in your management. Then examine the patient. You will find here in the map, I have written also the examination part. Everything you need to do in the examination, check the observations, body mass index, and the points of the examination based on the station. Okay, this is in terms of examination. um, you will find also in my maps the investigations is written based on the station, but here you don't need to do anything, so I didn't write anything in the investigations part. Then your management, you will find the management part is written in a simple way to give it to the patient. In each map I have written the diagnosis in a simple way, just for you to take the idea how to explain the diagnosis to the patient in a very simple way. After that, our management part, the addressing the concern. The first thing, if you didn't manage to address the concern the first thing, please try to address the concern while you give the management. Then your management should be shared between you and your patient. It's a mutual responsibility between you and the patient. It's not only to treat the patient, it's not only you to treat your patient, or not the patient to treat himself. It's a mutual responsibility. You need to do few things to the patient, and the patient needs to do few things to himself or herself. All right, then please leaflets, safety, and follow up. You can't let the patient go to his home or her home without giving them reading materials. You can't let the patient go home without safety netting them. You can't let the patient go home without seeing them again to check if everything is going in the right direction or not. So this is our mind map. Let's talk about the muscle sprain quickly. You will greet the patient and introduce yourself. The patient is in pain, so try to acknowledge that he is in pain. Is he comfortable to talk? And ask him, did anybody give you any painkiller? Because he is in the hospital. Try to act as you are in the hospital, doctors. Try to think logically. You are in the A&E, and you now talking to your patient. In the hospitals, before you talk to your patient, the nurse come and check if the patient is in pain. They can give them painkillers. So ask the patient, did anybody give you any painkiller for this? And please don't offer painkillers. It's as per GMC. Don't offer painkillers during your station. Just ask them, are you comfortable? Did anybody give you any painkillers? Then tell him, I'll make sure to give you a strong painkiller for your pain. Then explore your exploration, as you can see here. It's a pain, so explore the pain as Socrates, if you like Socrates, but I don't like Socrates. I like my way. It's in 4 points only. Anywhere, where exactly the pain, does it go anywhere else? This is the first thing. The second thing, how did it start? How bad is the how can you describe this pain, and how bad is the pain? Then, is it continuous or comes and goes? Anything that makes it worse, anything that makes it better, you need to know this, because they will give you a clue to guide you what is this pain. Associations, it means the dizziness and sweating, heart racing, the hemodynamic instability. And this is only if the patient is in severe pain. Then medications, you need to ask about if the patient has taken any kind of painkillers. It's not just to tick the box, no. You need to know what is the painkiller, to give the stronger painkiller in your management. Okay? Anything you ask, it is for a reason. It's not just for ticking the boxes. Then any specific thing happened. Dr. Andrew asked me this question. The answer is I was playing squash. Then anything else? In anything else, doctors, please don't ask every and anything. Once you find out what is your problem or what is the patient's problem, go with it. Don't go deep in your differential diagnosis. You just have only 8 minutes to finish everything. Please, please. Don't ask lots of questions in your differential diagnoses. Just exclude the red flags and that's it. The red flags in back pain are abdominal aortic aneurysm. You can ask him, do you feel any pulsating mass in your tummy or any tummy pain? The second thing is fever. Why you need to ask about fever? To exclude myelitis. It's common in patients who are a drug abuser. Right, then the third thing, coda equina. You need to exclude this because this is an emergency situation and you need to admit the patient urgently and involve the specialist. What are the questions in coda equina? Ask the patient, do you have any pain going down to your legs? Do you feel any numbness in your legs? Do you feel any numbness around your back passage? Any problem in controlling urine or stool? These are the questions. So ask these questions and then move on to your past history. Did that happen before? Any medical conditions, any medications, any allergies? You don't need to ask about family history here or travel because it will not help you in your management. Don't waste your time. So skip family history and travel in this station. And I just need to highlight something, doctors. When you ask about family history, please, please, please specify what are you asking about. Don't tell the patient, do you have any medical condition or chronic medical conditions running in your family? Specify what are you going to ask about. Do you have any family history of similar condition or any problem in the back? Specify, just specify. I talk in generally. Okay, so here you don't need to ask about family history. Personal history is not important in this station, and if you're not convinced about this, try to think about um, diet, exercise, smoking and alcohol. Will it help you in your management? Will you mention smoking and alcohol in your management in this station? In this station? No. So skip this question. Leave the time for the most important things. Okay? You can ask here about sleeping. If he has like this pain for 3 or 4 days, ask him, do you have enough time sleeping? Is it affecting your sleeping by any mean? Just to show the examiner that you think broadly. Then psychosocial, you can ask about did that affect your daily life activity? Because it's in yesterday, you can ask this question. But if it's now, if the patient has this problem now or 3 hours ago, don't ask, is it affecting your life, your job, or your mood? It's not a logical question. So think about your question, or how to ask your question. Okay? Then ICE, ideas, concerns, and expectations. Once the patient tells you, Doctor, I am concerned about something, please ask him why. Explore what is in his mind to address that in your management. Then you will move on to your examination. You need to check the observations. Body mass index, examine the abdomen, the back. Why abdomen? To exclude any mass in the tummy. Back, you need to examine the back. He has back pain. You need to do something called the straight leg raise test to exclude sciatica or disc prolapse. Then examine the nerves. Here in this station, the patient doesn't have any kind of red flags, no numbness, no weakness, nothing to worry about, so you can skip PR examination. But if the patient has any alarming symptom, please do the PR examination and provide a chaperone with you. Verbalize that you are going to provide a chaperone with you. Then you will move on to your management or diagnosis first. Tell him from what you have told me, or you can explain your examination to the patient. I have found some tenderness here in this point. In addition to the symptoms that you have, I'm suspecting something called muscle sprain, or I'm suspecting that you have muscle sprain or tear due to overstretch of your muscle. You have told me that you were practicing squash yesterday, so it could be a reason for this back pain. Don't worry, it's a self-limiting condition. Tell the patient the diagnosis and the prognosis as well. You need to tell the patient if this problem is self-limiting or ongoing for a long time, or is it serious, or it is lifelong. So please tell the patient the prognosis, then move on to your management. I was concerned about playing squash. Dr. Anju addressed that. Thank you, Dr. Anju, for doing this. So please address my concern. I was concerned about this, and she answered the question in a very good way. Then tell the patient what you can do to the patient in terms of giving him medications. You can give him muscle relaxants. And if he is concerned about his job, you can tell him you can self-certify yourself for 7 days. After that, if you still have this pain, you can ask your GP, and your GP will provide you with a sick note. This is if the patient is concerned about his job. So this is what you can do to the patient. What the patient can do for himself, many things. Take the painkiller on regular basis. Please tell him, please keep active. Please avoid lifting heavy objects. Try to do massage on the part of the painful part on your back, and try to do some stretches to feel better. And then safety net the patient. Tell him, watch out for your symptoms. If it's worsening, or if you felt that you have any problem in controlling your urine, your stool, or any numbness in your leg or your back passage, please do seek medical advice urgently. Then give leaflets to the patient and follow the patient up. Tell him the GP will follow you up. You are in the A&E, so you are not going to follow up the patient in the hospital. The GP will follow the patient up. Then ask the patient, do you agree on this plan? Are you happy with this plan? Are you satisfied with this plan? Do you have any concerns, any questions? That's it. Done the station, and you need to give your management in something called chunks and checks. Give a chunk of your management and check with the patient. Is he okay with this? If he can do this or not. If you are going to give him any medications, ask him, are you okay with taking this medication? Do you have any concerns regarding this medication? Are you following me? Are we in the same page? Are you getting me? These things. Okay? And you're not going to do all of this when you start your management at 6-minute bell, doctors. Please start your management very early in your station. All right, this is the first mind map. So let's move on the next slide.
Doctor, sorry.
Yeah.
The pre-rectal examination, we will do this if he has a urinary problem, right?
If you're suspecting that he has any kind of red flags, like if he has any weakness in his leg, any kind of numbness around his back passage, but this patient doesn't have any kind of red flag, even the pain doesn't go anywhere else. So it's you don't need to do PR examination. And
Yeah.
in the hospitals we don't do this, okay, because
Okay.
this is the logic, the logic way. Did you get my point?
Yeah.
Yeah.
Yeah. Thanks, doctor.
Thank you. So time for advice. So my advice today is for the starters doctors, or the new doctors in the PLAB 2. Please, when you decide to start, start. Don't postpone what you decided to do today for tomorrow. Please, don't postpone anything. Start now. Start with what you have. Start with your doubt. Start with all of your concerns. Just start. Once you start, you will move on. You will find yourself getting along with the PLAB 2, getting along with the stations, getting along with everything. You will build up your knowledge day by day. You will build up your skills. You will build up your interpersonal skills. Day by day, you will find in yourself a new doctor with extra knowledge, with extra skills, with very good and high interpersonal skills. Just start, doctors, and don't postpone anything. Procrastination is the thief of time. Please start and move on. Okay, so let's do the next station with Dr. Aldrin. Are you ready, Dr. Aldrin?
Yes, doctor, I'm ready.
Okay, so yeah. Yes, so please read your question. You will have 1.5 minutes, then we are going to start. Begin.
Hello, afternoon. I'm Dr. Aldrin. May I confirm your name and age, please?
Yes, doctor, I'm James Collin and I'm 30 years old.
Nice to meet you. How may I address you?
You can call me James. It's fine, doctor.
Hi, James. So what brings you here today?
Oh, doctor, I have this pain here in my loin. It's going to the groin, doctor.
Oh, I can see that you're really worried about the pain.
Yeah,
But don't worry, we are here to help. We are here to help you.
yeah.
So you said it's going back to your loin. Can you tell me more about it? When did it start and the like?
Oh, doctor, it started 3 hours ago.
Oh, okay. And you said it's going down into your loin. Did you take any painkillers?
Oh, yes, your nurse gave me painkiller. I am getting better a little bit, doctor.
Oh, that's good to hear. Is there anything which is making it worse?
Nothing, no, doctor.
What about anything which makes it better other than the painkillers?
No, nothing.
Okay. So, James, on a scale of 0 to 10, 10 being the worst pain you have ever experienced, how would you grade it?
Oh, doctor, it's 8.
Oh, that must be really distressing.
Yeah,
But don't worry,
yeah.
we are going to take care of you. Do you have any other symptoms, James?
Yes, doctor, I feel sick since this pain started.
Oh, I'm sorry to. And have you vomited?
Yes, I vomited once.
Okay. And now, do you feel thirsty?
No.
Okay. Any other symptoms, James?
No, doctor, that's it.
It's fine. So, James, I'm going to ask you a couple of questions just to rule out a possible other possible causes of the pain. Is that all right with you?
Yes, doctor.
Okay. So, this might seem a bit intrusive, but I just have to know: are you sexually active?
Yes, doctor.
Okay. And do you use protection?
Yes.
Okay. Any discharge?
No, doctor, no discharge.
That's good. And do you have any pain whilst passing urine?
No, but my urine is smelling bad and cloudy as well.
Oh, I see. I see. Okay, that's okay. And have you noticed any blood in your urine?
No.
Okay, James. So is this the first time experiencing these symptoms?
Yes, this is the first time.
All right. So moving on to your past medical history, do you have any chronic medical condition that I should know of?
Nothing, no.
Okay. And are you so that means you're not taking any medication, right?
No, doctor.
So you're not. Are you allergic to any medication?
No.
Okay. What about have you ever had any surgical, any instrumentation down them? Any surgeries?
No, doctor.
All right. Moving on to your family, is there any family member with similar symptoms?
No, doctor.
All right. With regards to your lifestyle, James, do you smoke?
No.
Do you drink alcohol?
No.
How, do you take high fiber, high protein diet?
I do eat meat. Yes, meat and red meat and yes, these things. I like meat. Yeah.
Oh, okay, that's good to hear. Do you think you take enough water?
Yes.
That's good. So, what do you do for a living, James?
I'm a banker, doctor.
All right. So, okay. So today you couldn't go to work, or it is your day off?
Today, yes, I took it off, doctor. Yes.
Okay, okay. So, James, thanks for answering all my questions. At this moment in time, I would want to examine you. I would want to measure your blood pressure, do a general physical examination, measure your blood pressure, your heart rate, your respiratory rate, as well as I would want to take your urine. Examine your private area as well in the presence of a chaperone, ensuring your privacy. I would also want to take your urine to the lab and test it, as well as do the routine bloods. Is that okay with you?
Okay, doctor.
Okay. All right. All right, James. have you given any thought about what might be causing this, James?
No, doctor.
All right, I'll address that in a second. So, James, do you have any other concerns other than the pain which you said is coming from your groin area?
No, doctor.
That's fine. I'll try to address that as well. So, from what you've told me and from the results which I've seen, I suspect that you have a condition called a urinary stone. Have you ever heard about it?
Yes, doctor. Urinary stone. I know this. Yes.
Oh, okay. So would you want me to explain to you in a simple term, or I can just move on to how we're going to address, how we're going to do?
No, you can tell me, doctor. What are you going to do for me, please?
That's good. So since you're having, we're going, for now, since you're in the A&E, we're going to keep you for a moment, for a while. We're going to give you some fluids, as well as we're going to give you some painkillers for the pain to address that one as well. Then the other thing that we're going to do is, since you're feeling a bit nauseous, we'll give you some antiemetics so that you won't vomit. Are you with me?
Yes, I am with you, doctor.
That's good. So for us to confirm that is a urinary stone for sure, we'd want to do what is called a CT of your abdomen. Then we'll see whether it's a stone or not. But most likely it's a stone. Are you with me?
Yes, I am with you, doctor.
Good. So depending on the size of the stone, some stones which are small, they can pass on their own. They just have to take a lot of plenty of oral fluids. So that's the first thing. Are you with me?
Yes.
Okay. So if the stone, however, is quite big and it cannot pass through your front passage, there are other methods that can be used, such as it's a small procedure called shock little chips. There's just some laser which is put down there in the abdomen so that they can dissolve the stone. They need to pass through the front passage. Are you following?
Yes, doctor. I'm following you.
Okay. In case all those methods fail, that's when you will be taken to the theater for operation to remove the stone. That's a last resort measure. For now, we just want to we'll start with the basics which I've told you about.
Okay. Okay, doctor.
So,
Time.
Jim, any other
No, thank you, doctor. Time is done.
uh,
Okay, thank you, Dr. Aldrin. Thank you so much for your participation. So, how do you feel before I give? Did you manage to read the examination part?
Yes, it was saying the left flank plus urine secretions with 2 plus of hematuria. But the
Okay.
other parts are it's still blurry. Yeah.
Okay, then use chart. Okay, no worries. So, how do you feel?
Um, from your advice, I think I should have started the management a bit earlier. I should have skipped up a couple of things which I did during the kindergarten course.
Yeah. Okay. You asked about smoking, I think, alcohol.
Yeah.
And
Mhm.
sexual, you can ask this question. Just ask him, do you have any discharge or unusual discharge coming from your private area? You don't need to ask about sexual or these things. Just ask about discharge and move on to the second or the next question. It's a logical
Oh, okay.
question, and it will save your time. This is the point. This is the only thing. Um, if you think about it logically, if the patient has any problem like pain in his loin going to the groin, so you suspect stones. Okay. Um, you didn't. In real life, are you going to ask him sexual life? You are going to ask him, do you have any discharge coming out from your front passage or from your private area, and that's it. Okay. So think logically about the questions. I didn't mean that I don't mean that you don't need to ask about discharge. No, ask about discharge because it's one of the differential diagnoses. Maybe this patient has urinary tract infection from a sexual transmitted disease, but ask it in a logical way. This is my what I mean. Did you get the point?
Oh, yes, yes, I do.
Yeah. What else? Yeah, in the management, before that, I liked your way in asking psychosocial part. It was a very good question and a logical question as well. Okay, by asking about the job and did you get the day off and these things. Very, very good. Okay, you asked it in a very logical way. In your management. So you were very organized. You observed me in the hospital, gave me painkiller, symptomatic treatment. Very, very good. But the thing is what? You are trying to reciting the management rather than involving the patient. What I mean by this? Don't tell the patient we are going to do this. Are you following me? We are going to do this. Are we in the same page? We are going to do this. Are you getting me? No, it's not like this. Try to involve him a little bit by asking him. So tell him, so we are going now to talk about our management plan. Would you like to hear about it? Yes, doctor. Okay, we are, so because you have pain, we are going to observe you in the hospital until the pain is fine and also your symptoms. So, do you have any problem in being admitted in the hospital? Do you have any concerns regarding admission or being observed in the hospital? Try to involve him a little bit more rather than reciting or telling the points of the management and asking him, are you following me? Are we in the same page? And these things. Did you get the point, Dr. Aldrin?
Oh, yes, yes, I kind of felt as though I was repeating the same statement. I wasn't sure how to involve the patient. Yeah, I understand. Yes, I do.
Yes, you involve the patient, but you can involve him more than this. Did you,
Yeah.
I know that you get the point.
Oh, yes, I do. Yes.
Yes, this is regarding your way. So let me give you the marks. Okay. So yeah, in data gathering, you asked almost all of the things apart from something. I will tell you what. Some red flags. You didn't exclude the red flags here. Three. In the management part, I would give you three as well. In the IPS, um, two or three. Okay. If you are going to involve the patient more, you would take three. Okay, Dr. Aldrin, but very good, very nice. The second map, which is urinary stone, you will greet the patient, introduce yourself, acknowledge that the patient is in pain, then ask him, tell me more, and then explore the pain. It's a pain, so you will explore it as any pain. Ask him any specific thing happened, and in anything else, please, doctors, try to ask the questions that are related to the station. Sometimes in the I think I have given you the question like back pain. Yeah, back pain. So don't be scripted and tell him, do you have any mass in your tummy, any coda equina symptoms, and these things. No, it's not the case here. The patient has pain in his loin going to the groin. Okay, so ask the urinary symptoms. Ask the urinary symptoms. In urinary symptoms, we have here lovely picture from our course. Any patient who is presenting with urinary symptom, ask or try to remember this picture. Ask about urine. Is there any change in the color or the smell of the urine, or any change in your urine? Any burning sensation while passing urine? Then any blood in urine? Any discharge? And because he is male, try to ask about prostate here. Ask him. Don't tell him or ask him the questions or the 4 questions of prostate, like urgency, hesitancy, and these things. No. Ask him, did anybody tell you that you have any problem in a gland called prostate? That's it. Then exclude anuria, please, doctors. When was the last time you passed urine? The patient has a stone or you are suspecting stone, so please exclude anuria. Then exclude pyelonephritis, especially the patient has problem in his urine, infection. Any infection, you need to exclude sepsis and dehydration. This is in any infection. Here, the patient has infection in his urine, so ask about pyelonephritis. Do you have any rigors? Do you feel lethargic? Do you feel that you are unwell? Alright, these are the symptoms or the symptoms that you need to ask in anything else. Then you will move on to your past history. You can ask in medical conditions any kidney diseases. Any kidney diseases. Personal history is not important here. You can ask about diet or ask about like if the patient is taking too much meat, nuts, drinking water, plenty of fluid, and these things. These are some risk factors of having stones. So you can ask about diet only. Psychosocial, you don't need to ask about is it affecting your day, your job, your mood. He has this pain since 3 hours only, doctors. The way Dr. Aldrin asked the psychosocial was very, very nice. So thank you, Dr. Aldrin, for doing this. Then ICE, examine the patient. You will check the observations and do abdominal examination. And you can examine the private area. You can do this and provide a chaperone. And you can skip it, it's okay. What are your investigations? Infection and inflammatory markers, renal function tests, calcium, uric acid. In terms of swabs and samples, you will take urine sample and culture for the urine. What you have missed, Dr. Aldrin, in your management, the urinary tract infection. You didn't mention at all that the patient may have urinary tract infection and you can give him antibiotic. Okay? So once you tell I would examine you and check observations and take investigations, the examiner will give you this picture. Just a second. Yes, this is the news chart. What is the news chart? Is then the National Early Warning Score chart. To read it, it is based on ABCDE assessment. As you can see, the respiration and oxygen saturation are in A and B. Blood pressure and pulse in C. Consciousness and temperature in D. Consciousness in D and temperature in E. You will find that the nurse or the doctor before you ticked the vitals based on the patient's vitals, and you will find that in each vital you will find like 1, 0, 3. This is based on the reading. Maybe the patient has his oxygen saturation is low, so this is a critical thing. He may take 2 in his vitals here in this section. Okay, so what is the total news score here? Is 2. It's 0 here, 0 here, 0 here as well, and 1 in the blood pressure, 0 here, and 1 in the temperature. The patient has high temperature, so it's 2. As long as it's below 4, so the patient is dynamically stable. Alright, doctors? Okay, so in the examination also they will give you tenderness in the left flank area. The urine dipstick shows hematuria. So these are signs of urinary tract infection, and from the history, the patient has colicky pain and pain going from the loin to the groin. So typically it's stone. So you can tell him you have a urinary stone in addition to urinary tract infection. How to tell the patient this? Tell him, Mr. X, you have this pain, and from my examination, I found tenderness in your left flank area, or the left part in your tummy. In addition to the investigations, I am suspecting something called renal colic or ureteric colic. Have you heard about this before? No, doctor. It's a spasm in parts of your urinary tract or waterworks to get rid of a stone. Or you can tell the patient, I'm suspecting a stone in your waterworks. In addition to that, you might have an infection in your waterworks because your temperature is high and you have a smelly urine and your urine is cloudy. It is treatable condition. This is the prognosis. Then your management. Here you are in the A&E, so you will observe the patient, give the painkiller, symptomatic treatment. The patient has vomiting and sickness, so give him antiemetic and involve the specialist. Antibiotic, you will give antibiotic only if you are suspecting urinary tract infection. What if you are in the GP? If you are in the GP or out of our clinic, you will manage based on the stability of the patient. If the patient is stable, you can give him painkiller and refer him to the hospital or to the specialist within 24 hours. If the patient is unstable and his vitals are not that good, you will send him to the hospital right away. Alright? You can give him an advice to drink plenty of fluid, and Dr. Adrien gave me some tips and points regarding the specialist treatment. You can talk about this, Dr. Adrien, if the patient is concerned regarding this. If the patient is not concerned, so you don't need to tell him shockwave and these things, and so save your time in involving the patient more. You will safety net the patient regarding anuria and sepsis when he goes home. That's it. Do you agree on this plan? Yes. It's okay, doctor. Thank you and thank you. And this is regarding the second station. So let me stop sharing the screen. Thank you so much, doctors, for attendance. Thank you for listening.